As we continue to hear stories exactly like those from many of you, it's no surprise the first month of the COVID vaccine rollout here in Florida has been characterized as confusing and chaotic, even though the state had months to come up with a distribution plan. I-Team investigator Adam Walzer talks with a retired general renowned for his handling of another major disaster about what went wrong with the plan and what's needed to fix it.
Long lines, hours on hold, and crashed websites. Fallout from Florida's COVID vaccine rollout. Michael DeGrosso lined up at 5 a.m. at a Citrus County site.
There was about a 4-mile wait of cars in front of me who, I don't know what time these people got out of.
He was sent home without a vaccination and has been unable to book an appointment.
So I keep getting the same information every day, that there is simply no vaccinations, and we will notify you when more become available.
Kim Flowers got an appointment through her primary caregiver in Pinellas County.
And she's scheduled me for a vaccine on the 18th. And then they called just a little while ago and said that the appointment was canceled because they were out of vaccines.
Because we're better than that as a nation. We have better systems than that. But we're not going back to that.
Lieutenant General Russell Honore is described as the hero who saved New Orleans after Hurricane Katrina battered the city, exposing deep-rooted problems in America's disaster response preparedness. He says he told President Trump in April that the National Guard should be mobilized to provide 24-hour-a-day testing and later vaccinations.
We got that as far as the White House, and we still know we don't want to do it that way. Let the governors figure it out.
The problem with that? 50 different solutions.
There's a reason we don't allow governors to control the airports in their states, because they would have the planes running into each other.
And General Honore said the federal agencies that should have been offering guidance didn't.
But what in the hell was CDC and HHS doing? It should have been in their wheelhouse to get the states ready to give the shot.
The CDC's guidelines were suggestions, not mandates, so they often were ignored. Governor Ron DeSantis put seniors ahead of people with chronic conditions, school teachers, and frontline workers like mail carriers and grocery store clerks.
All these sites, we want 7 days a week. We're trying to hit strong numbers.
But demand has far outpaced supply.
If you have only 1.6 million doses, we cannot give them to 4 million people, right? That's reality.
Dr. Ting-Long Dai is an operations management and business analytics professor at Johns Hopkins University. Dai says Florida has only given about 40% of available doses because of a manpower shortage, which he says is a nationwide issue.
We also should have as many points of distribution as possible. That seems the only way for us to be able to get this done.
And the vaccine itself poses challenges.
The complexity of that vaccine is different than anything we've ever experienced in healthcare. It's developed at very specialized facilities, the manufacturing, the distribution. When it gets to us, the storage with minus 80 degrees Celsius freezers that are very expensive and complex.
So how do you get that shot and have a capacity to give the shot so we don't have vaccines sitting on the shelf? And in this first phase, that has been the case.
Health officials initially saved second doses for each person vaccinated. But as production is ramped up, the CDC now recommends giving vaccines as they arrive. And the state has announced the opening of dozens of new vaccination sites.
We're going to do significantly more shots this week than last week throughout the state. And we will do, as long as we get more supply, we'll do more shots next week than we've done this week. And so that's the type of momentum that I think we want to continue.
Just like you saw in testing early on in this pandemic, it was a little slow, but it picked up really quickly as we gained more experience with what was necessary to do that safely and effectively. I think you're seeing the same thing with the vaccine.
A month into the process, still no guess as to when the state expects all Florida seniors to be vaccinated.
In the meantime, the most effective weapon we have is stay home, wear your mask, wash your hands, social distance.
I'm I-Team investigator Adam Walzer taking action for you.